What is the most critical step in the phlebotomy procedure? A. Site selection. B. Patient preparation. C. Patient identification. D. Tube labeling. Answer: C. Accurate patient identification ensures the right tests are performed on the correct person. Which tube is collected first in the order of draw for capillary specimens? A. Lavender. B. Green. C. Red. D. Gray. Answer: A. Lavender, EDTA, is collected first to minimize platelet clumping and preserve blood cells. Which of the following would most likely cause hemoconcentration? A. Drawing blood too quickly. B. Prolonged tourniquet application. C. Using a small gauge needle. D. Mixing the tube too much. Answer: B. A tourniquet left on too long can cause concentration of blood cells and analytes. Why must blood cultures be collected first when using a syringe? A. To prevent contamination. B. To avoid additive interference. C. To maximize blood volume. D. To avoid hemolysis. Answer: A. Blood cultures are sterile and must be drawn first to reduce contamination risk. Which of the following is used to clean the skin before a blood culture collection? A. Isopropyl alcohol. B. Soap and water. C. Chlorhexidine gluconate. D. Hydrogen peroxide. Answer: C. Chlorhexidine is preferred for blood cultures due to its strong antiseptic properties. Which situation requires use of contact precautions? A. HIV-positive patient. B. MRSA infection. C. Tuberculosis. D. Influenza. Answer: B. MRSA spreads through contact, requiring gowns and gloves. What should a phlebotomist do if a patient becomes pale and diaphoretic during a blood draw? A. Continue the draw quickly. B. Offer water. C. Stop the procedure and lower their head. D. Call security. Answer: C. These are signs of fainting. Stop the draw and ensure patient safety immediately. Which vein lies closest to the brachial artery and should be used with caution? A. Median cubital. B. Basilic. C. Cephalic. D. Radial. Answer: B. The basilic vein is near major arteries and nerves, posing greater risk. What can occur if a needle is inserted at too steep an angle? A. Hemolysis. B. Vein collapse. C. Nerve damage. D. Missing the vein. Answer: C. A steep angle may cause the needle to go too deep, potentially injuring nerves. What should be done immediately after removing the needle? A. Invert the tubes. B. Label the tubes. C. Apply pressure to the site. D. Discard gloves. Answer: C. Pressure prevents bleeding and hematoma formation. Which is the best method to locate a deep vein? A. Use a flashlight. B. Palpate firmly. C. Ask the patient. D. Apply a warm compress. Answer: D. Warm compresses increase blood flow, making veins more visible and palpable. What does a sclerosed vein feel like? A. Soft and bouncy. B. Hard and cord-like. C. Pulsating. D. Invisible. Answer: B. Sclerosed veins are hardened due to scarring or repeated use and should be avoided. What causes petechiae during venipuncture? A. High blood pressure. B. Improper needle insertion. C. Prolonged tourniquet application. D. Poor patient hydration. Answer: C. Petechiae, small red dots, occur when capillaries burst under prolonged pressure. Which blood test is most affected by hemolysis? A. Glucose. B. Potassium. C. Sodium. D. Hematocrit. Answer: B. Hemolysis releases intracellular potassium, falsely elevating test results. What is the minimum number of identifiers needed before drawing blood? A. 1. B. 2. C. 3. D. 4. Answer: B. At least 2 unique identifiers, name and DOB, are required for safety. A tube for which test should not be inverted? A. CBC. B. Point/INR. C. Blood cultures. D. Serum chemistry. Answer: D. Serum tubes without additives should be allowed to clot undisturbed. Which of the following is considered a nosocomial infection? A. COVID-19 caught in the community. B. MRSA acquired in the hospital. C. Food poisoning. D. Congenital syphilis. Answer: B. Nosocomial infections are those acquired in a healthcare facility. What should be done if the patient reports sharp, shooting pain during the draw? A. Withdraw the needle immediately. B. Continue drawing. C. Loosen the tourniquet. D. Tell the patient it's normal. Answer: A. Sharp pain may indicate nerve contact. Stop immediately to prevent injury. What type of blood collection is used for blood gas analysis? A. Venous. B. Arterial. C. Capillary. D. Central line. Answer: B. Arterial blood is required to assess oxygen and carbon dioxide levels. What condition can occur if the tourniquet is too tight? A. Nerve injury. B. Hemoconcentration. C. Petechiae. D. All of the above. Answer: D. Tight tourniquets can cause multiple complications including nerve damage and sample distortion. When using an evacuated tube system, what ensures vacuum is maintained? A. Sealed stopper. B. Needle gauge. C. Alcohol prep. D. Tourniquet. Answer: A. The vacuum is preserved by the rubber stopper sealing the tube. Which organization sets standards for phlebotomy procedures? A. OSHA. B. CDC. C. CLSI. D. FDA. Answer: C. The Clinical and Laboratory Standards Institute provides guidelines for lab practices. What is the best method to prevent needle stick injuries? A. Recap needles after use. B. Use two-handed technique. C. Use safety-engineered devices. D. Sharpen needles when dull. Answer: C. Devices with built-in safety features reduce accidental needle sticks. What can cause a vein to collapse during a draw? A. Using a butterfly needle. B. Excessive vacuum. C. Drawing from the median cubital vein. D. Using alcohol on the site. Answer: B. Fragile or small veins may collapse under too much suction force. What action should be taken if a tube does not fill during venipuncture? A. Push the tube harder. B. Reposition the needle slightly. C. Stop the draw immediately. D. Use a new tourniquet. Answer: B. Adjusting the needle's position may resolve the flow issue.